Hi, I'm Hannah, back with some hands-on training for mealtime. When assisting your loved one with eating, it is important to remember that this becomes more of a challenge as the disease progresses. Your loved one may become overwhelmed with this task, or may lose track of when they have or have not eaten. Encouraging independence while ensuring proper nutrition and reducing problems at mealtime are just a few of the concepts that will be addressed during this video. A healthy body equals a healthy mind for both you and your loved one with Alzheimer's disease. Eating the right foods will help to maintain a healthy weight and improve the overall well-being of everyone involved in the daily care process. According to the Alzheimer's Association, it is important to provide a balanced diet, include lots of colorful fruits and veggies, lean meats, and low-fat options for your loved one. Limit excess sugar, saturated fat, cholesterol, and sodium. Read the nutrition labels to determine what may be the best option. If weight loss becomes an issue as your loved one progresses through each stage, the doctor may recommend supplements between meals or adding sugar to various foods to encourage eating. Encourage hydration as much as possible. Integrate small amounts of water or foods with water in them, such as soup, smoothies, milkshakes, or fruit throughout the day. If you notice that your loved one has a decreased appetite, it may be due to a variety of factors. This includes not recognizing foods, dentures that do not fit properly, new or altered medications, not getting enough physical activity, or reduced smell and taste. Limit distractions during mealtime and keep the table simple and free of clutter. Provide them only with what they need. Doing so may help make the process of eating easier for both you and your loved one. Use a red plate or bowl, red cup, and red built-up utensils for increased grip to make food stand out more for your loved one when possible. This may encourage eating. Allow plenty of time for eating, up to an hour or more. Make sure the person is comfortable and sit them upright for at least 30 minutes to aid with digestion. Check the temperature of the food and offer one food at a time. Adopt foods as swallowing ability declines. Soft foods like applesauce or yogurt, adding food thickeners such as cornstarch or unflavored gelatin, or buying food thickeners from a pharmacy or healthcare supply store. Encourage self-feeding with cues. Put food on the spoon, wrap their hand around the spoon, and help them guide it to their mouth. Serve finger foods if they have difficulty with utensil use, chewing or swallowing. You may need to remind the person to chew or swallow before continuing with the next bite. Learn how to perform the Heimlich maneuver and recognize signs of choking. Don't hesitate to contact the doctor if you are having trouble getting your loved one to eat or drink, or if you have noticed a change in behavior or drastic weight loss. All right, so I'm going to kind of talk about these utensils and also the plate and cup and what their purpose is. So as you can see, they are all red. So research has shown that people with Alzheimer's who are in the later stages, if you notice they are not eating as much, they're not drinking as like they should, red plates, red cups, and red utensils help to make things stand out. So the food you put on a red plate, they're going to be able to distinguish that better. The drink you put in that red cup, they're going to be able to see that and they're going to be more willing to drink. In terms of these utensils, they look a little bit different. And so the handle is very built up, it's wider, so they don't have, it's really for those who have a decreased grip strength, if they don't have as much strength as they continue to decline, or even if they have other conditions like arthritis or they've had a stroke in the past, anything like that, it's going to help them a little bit to foster that independence as they continue to decline. These on the spoon and also the fork, these handles are metal and they're bendable, so you can bend them whichever way if they're right-handed or left-handed. And then I'm going to kind of demonstrate how to help them engage in their own self-feeding. So we'll have this fork here and you want to kind of bend it toward them so they don't have as much, they don't have to move their wrist as much, and this handle's thicker so they don't have to have as strong of a grip. So if you want to go ahead and grab that. Yeah. Okay. So one technique you can use is if they're having trouble bringing food to mouth, you can help them with it. So it's called just hand over hand assist. So you have pick the food up from the plate like this, and then you're going to help them bring it to their mouth. And these are just it's a cue that you can use to help them continue to eat and also to encourage that independence as much as possible.